anyway, to continue. So after they pound it and dilute it, they take 1 dose a day for 20 days and stop. That's a training period that's sensitizing the body to the remedy. Once it gets the idea, then it goes on all by itself. Weeks, months, literally years, without needing another dose. And you can sort of think of the 20 days of the LM potency as equivalent to the single dose of a C potency. And then I do the follow-up at 6 weeks, and I'm looking for the same thing, 10 to 20% improvement by Hering's Law. And if I see that, then we go 3 more months after that. There may be a healing crisis. I think that's probably in the range of 15 to 20% of the time. It's not anywhere near as common as it is in C potencies, where it's almost required to go on to cure. You have to have a healing crisis. With LMs, it may happen, and if it does, it's a good sign. And if it's and if it doesn't matter. You can still go on to cure. One thing I think I forgot to put in my slides here is occasionally somebody will be very sensitive even to the first dose of the LM. That typically the healing crisis on LMs comes in the 2nd or 3rd week. And like I say, it lasts a few days or a week and then clears up. Occasionally, and this is pretty rare, it's probably 5% of the time, somebody may react right away to the very first dose, not positively, but having an aggravation of their symptoms. One great advantage of LM potencies is that in that case, you can mitigate that by reducing the number of succussions. So instead of using 10 succussions and 7 drops, you go down to 8 succussions and 7 drops. And in some cases, even down to 6 succussions and 7 drops. Typically below 6, in my experience, doesn't do much good. I have students that have experimented even below that, and they confirm in their experience that it seems to make a difference there. So one of the great things about LM potencies is that you can mitigate the response in an oversensitive patient by the number of succussions. The mythology that I learned originally of doing serial dilutions does not pan out in experience. Even with sensitive patients, that does not reduce anything. And actually, now that we know the physics, that would just be maintaining without, if you do serial dilutions without more succussions, you're just keeping it at the same potency level by the physics of it. So there's no point in doing serial dilutions. I think it's more psychological, if anything. So my experience then, to summarize, my experience is that with C potencies, the cure rate is probably 30, 40%. A lot of that is because giving a dose too soon can really disrupt the case. And also, if there's an antidote, then you're in a dilemma whether to wait out the antidote and hope the body recovers, or to give a dose of the C potency again and take a chance of setting them back. All those complications in the C potency realm keep us from taking a case all the way to cure very often. So like I say, it's maybe 30, 40% in my practice. With LM potencies, we have less healing crises. If there is an antidote, if there is a real relapse, then you can actually give a dose, or sometimes you need to give, if there's an antidote, for example, and there's a relapse, then I've discovered that you have to give a dose a day for like 7 days to overcome the relapse. But the beauty of LM potencies is you can do that with impunity. and it works. It does work. So there's a lot more flexibility in the LM potencies, and the cure rate is much higher. I would say it's in the range of 80%, something like that, total compared to C potency. So I do advocate LM potencies these days. I think it's a big innovation. It's a big learning curve getting there, but maybe you can take advantage of the learning curve I went through and follow this method that Valerie and Elise Timmerman and so on advocate.